So hello everyone, we are going into part 4B, which is healthcare, which is also part of diversity. So let us recap. Alright, so in issue 2, we have covered about living in a diverse society. We talked about a few things, right? We talked about why Singapore was very attractive to foreigners, and one of the many reasons is definitely the community support, the safe environment, as well as our education system. We've also covered what are the positive and negative effects of living in a diverse society. All right, we talk about social mobility, specifically if you look at this. All right, we talked that, in many of societies, there are people who are of the higher SES and lower SES. We also talk about specifically how having more foreign workers or foreign talent will affect Singaporeans. All right, and these are all the effects of living in a diverse society. So what then is socioeconomic status? All right, we also unpacked, we talked about how the socioeconomic status of an individual may shape one's life experiences. We talked about how if you belong to different economic status, where you live, what you eat, what you do to entertain yourself, and what the activities may be different. And in a socioeconomic status, there are of course the higher end people, all right, or higher end status. You have the middle status, and of course you have the lower income status. All right, and we have uncovered why do governments have to deal with the widening income gap, because one of the many reasons is if the government does not step in and the income gap is too big, it will actually affect the stability of a country. All right, and definitely it is not only the government that is responsible, there are also other aspects of responsibility. All right, and just now I mentioned about instability. There could be a likelihood of tension that could arise, and it will affect the prejudice as well as the misconception of how people view each other. Now, today we're going to talk about healthcare and how healthcare is actually part of socioeconomic diversity. All right. Now, these are the 3 facts about healthcare, that definitely there are different economic groups that exist in any country, and irregardless of your socioeconomic status, you will fall sick and you will require healthcare. And specifically, if you look very carefully at here, now higher income group, definitely they will have better access, a better managed healthcare because they can afford, whereas those from lower income gap may even defer. Defer means they might not even get the treatment because they can't afford it. Okay, so when we talk about healthcare, there are 4 key questions that you are looking at, right? You'll be looking at first, okay, what is healthcare? You're looking at why is healthcare important. You're also looking at who are the providers of healthcare services, okay, and how do you make healthcare affordable? I think most of the time in terms of questions, I think this will be one of the key things that we need to look at. Now we are also going to look at the different countries. Okay, for social studies, we are looking at how USA, how Singapore, and how specifically Sweden actually manages their healthcare. All right, and this is of course a preamble or an introduction. Definitely that everyone needs healthcare services, irregardless of their status. Okay, governments play an important role in helping citizens with financial support. So the government's role is key. So you have to link up to issue 1, where we talk about the role of good government. Okay, and at the same time, if you look very carefully, different government and different countries have different approaches. So there is no one perfect approach to healthcare. It just depends on how the country decides for the good of its people. All right, so now we are looking at market-based approach, which is how USA actually handles specific healthcare needs of its people. So a market-based approach is actually when the government gives citizens the freedom to decide how much they wish to pay for the healthcare and allows the market to determine the types of services and costs of healthcare. It also means that the government does not put a price on any of the healthcare providers, any of the healthcare procedures. So specifically, they are looking at the demand and supply of things. So that means if there is a demand for more cancer treatment, hence the price of cancer treatment will increase. Now, how is it implemented? Now, USA does not have a national policy on healthcare, which means that different states actually have different way of handling their healthcare according to the people that is living in different states. So that means if I'm living in, for example, New York, it will be very different if I'm living in California or if I am living in Texas. So the state actually has the independent or the freedom to decide on how healthcare is being managed in their particular state. All right, and if you look very carefully, there are different types of hospitals in USA. Okay, you have the profit-making hospitals, you have the non-profit making hospitals, and you also have the public government hospitals. All right, so these are some examples of how there are private hospitals which focuses on profit making. You also have the public or the non-profit making kind of hospital. So you would expect different kind of services, you would expect different kind of class or different kind of expectations. All right, so while they offer the same type of services, it could be definitely very different. Okay, and this is very interesting because the government leaves the decision to the healthcare providers. So you have, for example, in Canada, okay, it would be very different price from USA. For example, in USA, the MRI scan would cost 1,000 plus, whereas in Netherlands, it would be 319. So literally, there is no fixed price. Okay, and specifically for Americans, most of them would actually have to have insurance, and there are many insurance providers. Okay, but of course, America being a very diverse country, they do not have everyone that could actually afford medical insurance. All right, and this is an example of a US medical health insurance, and most of the time insurance are actually received from the job that you actually take. All right, most of the big companies would offer their people insurance. Now, if you look at this particular map, if you actually zoom in, USA is ranked one of the lowest in terms of wealthy countries, but very low in terms of healthcare ranking. And these are some of the problems or the issues that USA is facing. Almost close to 200,000 people actually died because there were medical errors. There is a strain in medical bills. Specifically, you can see that 50% prescription drugs actually cost 50% more in USA than any other countries. All right. And it ranks 26 in the infant mortality. That means there's a lot more of babies dying. All right, and so many people are declared bankruptcy because they cannot pay medical bills. And you can see here from this particular cartoon, the waiting room, waiting to see doctors is actually quite long. So from this particular sources, you can see that USA healthcare may not be the best, or it may not be something that is so good for society, right? Okay, so how do you make it affordable? Remember the key question, how to make it affordable, because especially being a diverse country like USA. So one of the examples that was actually in your textbook as well as in your notes is USA has this policy called Medicare, and it is actually a health insurance for Americans above the age of 65 or under 65, and they are actually given subsidies, all right, to actually help them cope with the medical supplies that they have. All right, another example is Medi8. All right, and Medi-Aid is actually health insurance for Americans with limited income or have disabilities. Okay, so you can see that they have extended specifically from elderly persons, and even right now, even more since 2014, adults as well as parents. Okay, and this will help manage healthcare of other people who cannot even afford. All right, especially for those of them who are below the poverty line. So Medi-Aid actually does help. All right. Now, another example is that you would actually have all hospitals specifically will, by law, all right, provide care to anyone needing emergency treatment, because there have been cases where, you know, patients are being dumped outside the hospitals because they cannot afford or they do not have actually insurance coverage. Now, what are the challenges of a market-based approach? Definitely, if you don't have insurance, then you cannot have access to very expensive medical procedures. All right, as you can see from the cartoon. The cost of medical insurance. All right, many Americans do not want to buy insurance because insurance are not cheap, and especially for those people who are living below the poverty line and they don't even have a fixed income. I think it is very, very important that for them it is their daily needs, which is the food, which is electricity, which is paying for bills. Those are more important than actually paying for insurance. Another thing is smaller companies will not provide the best healthcare benefits, and especially low-skilled workers, they are not provided any healthcare insurance. And if you don't have any healthcare insurance, it is actually very expensive to actually get medical treatment in USA. All right, and because many of these Americans are of lower socioeconomic status, then you can see they self-medicate, like this particular picture. Now, challenge 2 is the coverage of medical insurance. All right. Sometimes insurance companies, because their concept is definitely profit making, they are also very selective on the type of pre-existing conditions and what they will cover. Okay, so now how does insurance work? Okay, this is a very simple infograph, all right, of how insurance works. You can pause here and you can try to understand how insurance works. So in America, it is actually very difficult to sort of get cover for all types of diseases. So they are very particular about it. And if you are found to be suffering from some sort of pre-existing condition, then they will not cover you for any future healthcare needs. Okay, so that means if you go to a hospital and you realize that, oh, actually there's something wrong with your bones or something like that, and if you need treatment because of some bone issues, you know, you will not be covered. So what are the solutions to help America? So one is definitely a direct subsidy to citizens. Okay, that means literally giving money to the lower income groups or the lower SES. Okay, and in 2014, when President Obama was in power, all right, he introduced this thing called Obamacare, and in Obamacare, more people actually had access to medical bills. Specifically, you can see that how much is actually being invested, almost close to about billions, 3.2 billions. Okay. Now, of course, when Trump came in as president, the Obamacare was actually removed. So it's back to square one. All right. So while USA had actually this concept of how the government does not interfere, and even if the government interfere, it is actually not a lot and has not been successful. Okay, but in Singapore, we're going to look at the other end, where instead of the government not playing a part, in Singapore we are looking at shared responsibility. So shared responsibility, you can have the idea that it's definitely the government and someone else, correct? So definitely in Singapore, the government provides basic healthcare services. The keyword here is basic. Citizens must play a part in financing their own healthcare needs. So how is it implemented? Okay, we are looking at this. This is a very important infograph. So for example, imagine that this is you, all right? So how do you get access to medical treatment? First, it could be government subsidies. It could be the company that you're working. It could also be via your CPF, all right? Your MediSave, MediShield, your MediFund. It can also be your own cash money and as well as personal insurance. So what does shared responsibility mean? Again, it means your individual responsibility first, the government subsidize, and of course the 3 M's, that is actually government as well, using your CPF, and of course you have the community support, where some of these community hospitals offer free medical treatment for specific groups of people. Now, the government set aside what we call the CPF, all right, to MediSave to help Singaporeans pay for healthcare. All right, it allows patients to take personal responsibility. All right, the type of services and where to seek these services. And this is another infographic about specifically CPF. You can pause and then you can read what it means. Okay, so this is what I meant by the different treatment. You can actually choose the different types of wards that you can choose. You can choose the A class ward, you can choose the B class ward. And these are the different benefits of the different beds, the B1 all the way to B5, and C6C bedded, 6 bedded wards, 6 bedded rooms. Okay, and 8 bedded rooms, and this is based on Tan Tock Seng. And if you look very carefully, the price of each room actually differs. Now, of course, there are many ways to use your MediSave. All right, these are the different ways. So again, MediSave, it is definitely comes from your money as you work. It is actually channeled into your CPF, and the government actually uses MediSave to allow the citizens to use that first, and in the event that MediSave is not enough, then there are other avenues such as government subsidies or even MediFund. Okay, so these are the types of subsidies specifically for primary care and especially those that need long-term care. All right, these are all the different examples. All right, you have your St. Andrew's Community Hospital, you have your nursing home. So these are some examples of community help. Okay, now how do you make sure that Singapore's healthcare is affordable? All right, now the first thing is, of course, the government ensures that there's subsidies given. Okay, co-payment sometimes. It depends on which aspect of SES you are in. All right, if you work, definitely you will have money in your MediSave. Okay, you also have all these other plans like ElderShield, now it's ElderShield Plus, MediShield Life, MediShield Life Plus, where it is actually about long-term care needs. Okay, it is sometimes co-funded by the government, but it is also through your MediSave. Now, at the end of it, it's definitely your MediFund, and MediFund is like the last resort, a safety net, which the government actually provides specifically for patients who have finished their subsidies, finished their MediSave, they have already finished all this extra money from different schemes, and the government steps in. So it is definitely a fair process where if you can afford, you pay first and then the government subsidizes the rest. Okay, there are some cartoons here to sort of help you understand a bit deeper about this. Okay, and one of the recent one is this CareShield Life, and you can see that, you know, it actually helps in ensuring that premiums are fully paid in MediSave. Premiums are just extra top-up money that you can put in your MediSave. Now, what are the challenges of a shared responsibility approach? Just now, you could actually see that USA also faces a lot of challenge where, you know, it is expensive, right? So how about us in Singapore? There are possible challenges. There could be an increase in aging population. People are living much longer. medical advances require a lot more cost, all right, and the number of dependents, that means people who can support the aging population, they are dropping, all right, and of course labor shortage. If we have less people in the workforce, definitely you will need to have your foreign talents coming in, and these are possible implication living in a diverse society. So one of the things that we actually are doing, all right, we are trying to grow the healthcare demands, all right. So example is, because of the aging population, right? We're talking about that, right? So another challenge is definitely, of course, the high cost of healthcare due to inflation. You can see if your salary is as such, and all these are required, how much are we going to put aside for healthcare? Okay, so one of the solutions is to provide even more infrastructures, more hospital beds, more new hospitals that's coming out. Sengkang Community Hospital and Outram Community Hospital is coming up, all right. These are some of the plans that they're going to have to increase the number of hospitals, given that we are foreseeing the number of patients may increase. Improve primary care, meaning that literally family doctors are able to help in ensuring that certain chronic diseases are actually flagged out much earlier. Okay, so we are improving the quality of primary care. That means not everything is bottlenecked at the hospital. At the same time, we are also improving subsidies. All right, and we have, I think you're quite familiar with this, the CHESS card, the CHESS Pioneer card, in ensuring that for people who have lower SES and elderly, there are subsidies given to them. So this is an example, a case study, all right. And these are examples of how actually healthcare can be expensive, but based on all the different subsidies as well as the use of MediSave, you can see that the patient from 15,000, the patient only pays about 678. All right, and of course, nothing beats this to create awareness. All right, to educate patients about taking care of their health much earlier. All right, and example, whether it's mental health, whether it's physical health, I think that is very important. So the last healthcare approach that we are looking at the government finance approach, which is from Sweden. Okay, now for this, the government plays a definitely active and more direct role in providing subsidies, and definitely citizens sort of pay lesser. Right. Now, how is it implemented? Please remember this. Sweden offers what we call a universal access to healthcare that is heavily subsidized. Of course, there are private and public healthcare services as well. It's not that the Swedish people do not pay. They pay. They pay a nominal fee. All right. And they do pay from their pockets. Okay. But there is a fixed ceiling. That means they only pay up to a certain amount, and the rest the government will subsidize. Now, how do you make such a healthcare system affordable? All right, so first things first is definitely there are heavy personal taxes on the people. Okay, healthcare, because you need money, right, for you to actually pay so much and help provide so much for the people, because it's so heavily subsidized, then your personal tax or your income tax is actually a lot in Sweden. Okay, and you can see that there is a cap. Above 20 is only charged like €9 per day for hospitalization, which is actually relatively cheap in comparison to other European countries. So patients pay a maximum of this amount, all right, and ceiling payment for medical fee is about €220. Patients pay full cost of medicine until a certain amount, and all this scheme also applies to children, it applies to aging population, it applies to some groups of working adults. Another way is definitely private insurance. Swedish citizens do also have insurance, and insurance are especially for patients who want quick access to a specialist and avoid very long waiting list for treatment. Now, what are the challenges of having such a government finance approach or government subsidizing so much, right? So the first challenge is definitely the high tax, okay? And even though the Swedish people are willing to pay this high tax, you must remember that there is an aging population, and that will create some sort of tension because there are lesser working adults and there are now more to support. Right, and if you look very carefully, this is the amount of personal income tax that different countries have to pay. And you can see that Sweden is the highest in comparison to Finland or even Singapore. So now if you look at this, right, this is the amount of personal income tax that Swedish people had to pay in 2018. It's about 61% of their total income, whereas in Singapore it's about 22%. So you can imagine the numbers or the amount that a particular person, as they are working, how much they're bringing back, right? This is, of course, sales tax rate. Sales tax rate is like our GST. So the Swedish actually pay about 25%. All right, we pay about 7% and we are making a lot of noise. All right, now for most Swedish people, they are okay with paying high taxes because they do benefit. They benefit in terms of whether it's education, whether it is actually even healthcare. But it may not be applicable to everyone. Right, now they are attached to this idea of the people's home, that everyone must be protected. So Swedish people, or people living in Sweden, they have a different kind of community spirit that may not be applicable to other countries. Okay, now the other challenge is definitely the growing number of people. Like I said, there is an increase of aging population. It does not help that if there is no increase in birth rate, then how? Right? Then how do all these people actually afford the very highly subsidized healthcare? And because the healthcare is so good in Sweden, right? There are many migrants who are coming to Sweden and is taking a strain towards the system. Okay, and some of these migrants are jobless, but they still are eligible for government financed welfare benefits such as healthcare. Now, the solution to this, there's no solutions because the Swedish people, they are quite happy with what they are doing. Whether in the future there will be challenges, I think that is up for us to see. So today what we've covered is the three main countries: USA, which is definitely a market-based approach; Singapore, which is a shared responsibility; and Sweden, it is a government finance approach. So you can pause at any parts of the video and listen to it again so that it is clearer for you and it makes sense for you as well. Okay? Alright, so see you in the next other video. Bye-bye.